friends. Welcome to the Mama Doc Baby Doc podcast.
I'm Renda, a board-certified OBGYN.
And I'm Rachel, a board-certified pediatrician and Renda's oldest and best mother.
Oh, goodness. Welcome to the podcast, everyone. We are so glad that you joined us today. Rachel is a new mom. So, Rachel, how is JJ doing? Is he sleeping well?
No. It's so weird hearing you're a new mom. That's such a weird thing to be called a mom. That's so strange.
You're a mother.
I know. It's weird, but it's true. He's doing really good, but he is not sleeping good at all. Yeah, especially at night, just not good. So if I look exhausted today, that's why.
That might be why. Well, today we are going to discuss sleep safety, which is something that is very important for JJ.
Yeah, definitely. I've only been a mom for like a month, and this safe sleeping is one of the few things that I found that surprised me, that shocked me.
Really? What was so surprising about it? What do you mean?
I mean, we all know the safe sleep recommendations, but I didn't realize how really hard they are to follow. I've had many patients who will come to me and say, hey, these are really hard recommendations to follow. Like my baby won't sleep anywhere other than being held.
Well, then you should just hold him. Just hold him.
Yeah, okay. Some people have to sleep. But
you cannot spoil babies, Rachel. The more you cuddle them, the sweeter they become, okay?
I know. Well, he's going to be the sweetest baby in the whole entire world because that's all he wants. But yeah, like patients will come to me and be like, the second I lay him down, he starts crying, and or they won't sleep anywhere other than one place, like being snuggled by mom, or the parents have a lot of anxiety. They'll come to me and they'll say, I'm so scared that they're going to just randomly stop breathing, or my baby has a lot of reflux and I'm scared they're going to choke in their sleep while I'm sleeping. And before having a baby, not that I like brushed off these parents' concerns, but I don't really think I understood quite how hard it is. I didn't really have a lot of experience, and I definitely didn't have the advice to give them to help. I would always just, say, here, these are the recommendations. Good luck. Have fun with your baby. Now I feel like having JJ, I kind of understand these concerns a lot. But I mean, I know you say holding them makes them sweeter, but this is your fault. This is all your fault.
I take full credit for it. I take full credit.
You were here a week after he was born, for like a week, and held him the whole time, and now he doesn't want anything else, and it's all your fault.
That's what grandmas are for.
For sure. Well, I mean, like, I definitely over the last month have fallen asleep with him in my arms a couple times, and it just gets really hard when you're tired, you're exhausted, and they refuse to sleep anywhere else. The second you lay them down, they start crying. So like, I know the importance of the safe sleep recommendations, but now I really have like a new appreciation for how hard they are to really follow.
So I have to admit that I have fallen asleep with you and really all of my babies at one time or another. So, we all know the recommendations are important. They're important to prevent SIDS, or sudden infant death. So why don't we talk a little bit about that? What is SIDS? How common is it? I actually have a friend. I delivered her baby, and she called me a few months after the baby was born to tell me that her baby died of SIDS, and it was heartbreaking. It was really, really, really awful. Yeah.
That sounds awful. I mean, that's like every parent's worst nightmare, But I want everyone to know that it is rare. I don't want anyone to be scared or feel like if you fall asleep holding your baby one time, this is going to happen to them.
Right.
Really, 3,500 infants less than a year old every year in the U.S. die from SIDS.
Wow.
And accidental suffocation. So, I mean, while 3,500, that's a lot of babies in comparison to how many babies there are in the United States. It's really not a lot, and it's very, very rare. So that number, it not just includes SIDS, it also includes accidental suffocation and just really other unknown causes, like we really don't know what happened. So definition of SIDS is sudden death of an infant less than a year of age, and after they've done a thorough investigation, including autopsy, they don't know what happened. It's just unexplained. Yeah, really, really sad. And then, but deaths by accidental suffocation, that's something different and separate, and not included really in the definition of SIDS, but they're all under this umbrella. So like if you Google SIDS and you find the CDC website, they'll, instead of saying SIDS, they say SUID, which is sudden unexpected
Unexplained. Okay, got it.
Yeah, and that includes SIDS, what we commonly think of as SIDS, and it also includes that accidental suffocation.
Right.
Yeah, so really we've seen the rates of these things go down a lot recently. So the SIDS rates declined. They were 130 deaths per 100,000 live births in 1990. So not that long ago. Most of us were alive at 1990. So 130 then, and then when they recalculated it in 2020, it was 38. So it went from 130
huge
down
decrease.
to 38. Yeah,
That's
exactly.
really remarkable. Yeah.
Yeah. But on a side note, that doesn't include rates of accidental suffocation. Actually, those have kind of went up a little bit, slowly increasing since that time. This is mainly just SIDS, where we, after autopsy and everything, we don't really know what happened.
So why do you think SIDS has gone down? What's different?
Yeah, when we look back at that time period, 1994, was when they really started the Safe Sleep campaign and the Back to Sleep campaign.
Oh, that's right. That's right.
Mm-hmm.
Yeah.
And really more efforts to educate people on safe sleep. That started in 1994.
Right. So that's amazing. Now, I know that you were born before 1994. And at that time, when you were born, we thought that sleeping on, having babies sleep on their tummy was best. So in case they would spit up, they wouldn't aspirate. And that's what I was told when I had my first children. But, that's what I love about medicine. We change our recommendations. We learn new things and we adapt. So, Rachel, why don't you tell us what are the actual safe sleep recommendations other than putting the baby on the back?
Right. So if you look at the American Academy of Pediatrics and what they recommend for safe sleep things, really the safe sleep recommendations, the purpose of them is to lower the risk of SIDS. So as many of the safe sleep it's a tongue twister, safe sleep recommendations do to decrease to as much of the safe sleep recommendations that you can do in your home with your baby, then you will lower your risk of SIDS. So as many of them as you can do would be better. Right.
That's good.
So most of us have heard of the importance of putting infants to sleep on their back. Like, everyone knows back to sleep. It's like plastered on the swaddles at the hospital and things like that.
Right.
And that is the biggest one. And one of the ones that, if you can do that, would make the most, lower their risk the most for SIDS. So the official recommendation is sleeping on your back until 1 year of age. No sleeping on your stomach and no side sleeping. Also, the bed should be flat, no elevation to the bed, and firm. So not soft, not comfy. I know John is always like, of course he doesn't want to sleep in the bassinet. It's not comfortable. It's not soft. Well, it's not supposed to be. It can't be.
Right.
No soft blankets, no crib bumpers, no stuffed animals. I know, my generation, a lot of us had crib bumpers, but
definitely you did.
I remember.
Also, I got you these little they were sheep blankets that were sheepskin, so they were very, very soft and furry.
I know, it's a wonder we're all alive these days.
I know. I don't know how you survived.
But the one thing that's really popular now are boppies and like the snuggle me loungers, things to kind of like snuggle the baby in and make them feel like they're being held. But anything like that in the bassinet or when they're sleeping, when you're sleeping and not watching them is not recommended and not safe. Just a suffocation hazard for them. I have a lot of parents who will come to me and say, I lay the baby down on their back and they roll. And it's a newborn.
Right.
And I'm like, well, newborns don't roll, but what I know when I see newborns is they do that newborn scrunch thing. I know everyone knows when you pick them up, their little feet scrunch up and they want to curl into a ball like they were when they were in the belly. And so if you lay them on their back and they do that little scrunch, their back is curved, so they're gonna naturally roll a little bit to one side or the other.
Right.
They're not gonna roll completely over. And this, if they're in a firm, flat mattress, a little bit of a roll isn't gonna push their face into the mattress to where they're gonna suffocate, if that makes sense. So it's okay if they scrunch and roll a little bit. But you don't want to roll them or put them on their side. But if they do a little bit, that's okay.
Good. So, when you were a baby, we were told that if you put your baby on the back, they might aspirate, right? They would have a little bit of spit up and then swallow it and get it down in their lungs. What's the deal with that?
Yeah. Just like you said, back then that was the recommendation. And I have a lot of parents who come to me and say the same thing, especially babies who have a lot of reflux, because it's really normal for babies to have reflux. It's normal. But they're worried, hey, what if they have reflux in their sleep? Are they going to aspirate on it? Are they going to choke? Is it going to make it so they can't breathe? I know. But the North American Society for Pediatric Gastroenterology and Nutrition, so like the PEDS GI doctors, their association, they came out with a statement that said the risk of SIDS outweighs the benefit of sleeping on their stomach, basically. Most babies who are normal, made normally, have normal anatomy, they, even if they're on their back, don't have that risk of choking and suffocating from choking in their sleep, as long as you have like a normal baby with normal airway anatomy. Now, if your baby has different anatomy, then your subspecialist will tell you that and give you the specific way for them to sleep. Gotta talk today. I need more sleep.
Apparently. What about tummy time? Because I've heard like tummy time is important for babies, right?
Yes.
Yeah. So they can do that, but just not when they're sleeping. Is that the deal?
Of course. So you definitely want to do tummy time for your baby, starting from when they're a newborn, because the tummy time is what strengthens their neck muscles, right? So it helps them kind of strengthen those muscles so they'll be able to hold their head up on their own. So yes, definitely tummy time, starting from when they're first born. You can start it, help strengthen their muscles. And also it's really great for flat heads. I don't know if you've seen, since we started the Back to Sleep campaign, a lot of babies will have.
I have seen that. The flat head, I've seen that.
Yeah. And parents are always so stressed out about it. But basically, it's called positional plagiocephaly. The bones of a baby's skull are not fused together. So like how ours is all one skull, theirs is separate little bones. And the purpose, the purpose is one.
So they can come out of the birth canal, right?
Yeah, when they're born, they can be squeezed out and they're not crushing their skull. Yeah, exactly. So any type of extra pressure on their head, one side or the other, for an extended period of time is going to make molding on their head, kind of like
like
born,
like the cone head that they come out with, right?
Yeah, exactly. So since we started laying babies on their back, they have hot spots on the back of their heads, and it's just because of the way that they're made. When they start sitting up, holding their head up more, rolling over and liking to be on their tummy more, then their head will kind of go back to the shape that it was meant to be. Now this doesn't account for babies who have developmental delays. So if you have a baby who has a developmental delay that maybe is going to spend an extended period of time on their back and isn't going to be sitting up when normal babies sit up, or holding their head up like a normal baby would, then at that point we do some helmets and things like that. But if you have a normal baby who is going to be sitting up at the right time and doing all those good things, then we normally don't do helmets because your baby's head will go back to its normal shape.
Got it. That's
yeah.
Another thing, Rachel, I remember that when my kids were little, we were told that sleeping with your baby in the same room could decrease the risk of SIDS. And I don't know if you remember this, but your little brother, our youngest child, little Edson, he slept in our room until he was about 5 years old. We could not get him out of our room, but that's a totally different problem. So why don't you tell us about recommendations for sleeping in the same room?
You cut out a little bit. I don't know if it was my internet or yours, but it sounds like you're asking, should they sleep in the same room as you?
Right. That's maybe not asking.
Maybe not when they're 5, but honestly, 75% of my patients, 5-year-olds, they sleep in the room with their parents, so it's fine too. But yes, for newborns, another recommendation to decrease the risk of SIDS is room sharing, but not bed sharing. So you want to have the infant in your room until at least 6 months of age is the recommendation, but if you can keep them in there till a year, that's even better. You want their bed to be in view of where you're sleeping and really in reach if you can. So that way you can kind of reach over and soothe them, and definitely so you can see them while they're sleeping if you just happen to wake up and look over there. Evidence shows that sleeping in parents' room but on a separate surface decreases the risk of SIDS by as much as 50%. So it's a big deal. And and it's always a good idea to have them where you can see them and watch them. There are things that increase the risk of SIDS when you're bed sharing. So I know, sometimes parents, for one reason or another, choose to bed share. And we'll talk a little bit about that later. But there are things that increase the risk of SIDS when you're sharing a bed. So if the parent is impaired by drugs or alcohol, or even certain prescription medications like anxiety or depression medications that can be sedating.
Yeah, they can. Right.
That can make you sleepy. Anything that's going to make you extra sleepy, that will increase the risk of SIDS if you have the baby in the bed with you. Another thing we found just through studies is if the parent's a current smoker. So if the parent smokes, then there's a higher risk of SIDS. If the adult that the baby is bed sharing with is not the child's parent, so a babysitter, grandma, grandpa, aunt, uncle, that increases the risk of SIDS. And then, of course, bed sharing with soft blankets, soft pillows, or on a soft surface like a couch or a chair. It's really important to note that there is an increased risk of SIDS on couches and chairs. Because the child can slip from your arms into like all the cracks and crevices and soft spots in the couches and chairs. So if you, for some reason, end up falling asleep with the baby in your arms, it's safer to do in your bed than it would be on a couch or a chair. So keep that in mind.
That makes a lot of sense. Another thing I've heard is that, moms who breastfeed, they often find it easier to share a bed so they can feed easier in the middle of the night, and do smaller, feedings just whenever the baby wakes up and is hungry. So what are the recommendations about that?
Yeah, I have so many parents who tell me that they bed share with their breastfeeding infant. And if you have ever breastfed a baby, or know someone who has, the first couple days to weeks, they want to eat all the time. And they're like hungry every couple seconds.
Right.
So it's really hard at night when you're trying to sleep and you don't want to put them in a bassinet. By the time you're laying down, they're wanting you to feed them again. So I can definitely understand the parents who choose to do this. I can sympathize with it and I get it. However, the AAP, American Academy of Pediatrics, does want you to know that they cannot recommend bed sharing under any circumstance for any reason. The risk of SIDS is too high, and it really outweighs the benefits. But you know, I know a lot of parents who do this basically because they're just exhausted, and it's hard. It's really hard, bottom line.
Right.
But studies do show that even for breastfed infants, there is an increased risk of SIDS when you bed share an infant under 4 months old. So we can say that. But what I will say is I can be sympathetic now having a baby who doesn't sleep.
Right.
And I think a lot of people can sympathize as well. But the American Academy of Breastfeeding Medicine has come out with some recommendations for moms who do choose this to make it safer for you if you do choose to bed share with your breastfeeding baby. So they're the safe sleep 7. There's a lot of S's in this.
Safe sleep 7.
Safe sleep 7. And these are just rules or recommendations for making bed sharing as safe as possible. So number 1, no smoking in the home or outside. If you smoke, it just increases the risk too high, and the benefits outweigh the risk. Number 2, as the adult, you have to be sober. And this includes any drug, any alcohol, and then any drowsy medications too, like we talked about, Benadryl or anxiety, depression medications. 3 is really, these are best really just for breastfeeding infants, and you want to be breastfeeding at the breast. Bottle-fed infants, this doesn't really apply. And 4, another one for 3 is you want the baby at breast level. So when you're sleeping with the baby, you are facing the baby and you want the baby at breast level, not at face level. And you want to kind of make a C around the baby into a C position. That is the safest way to kind of sleep with them. And it makes it easier for dream feeds and things like that. So dream feeds, are when the baby's still sleeping. The baby's still sleeping, and you just feed them while they're still sleeping.
Right. So you call them dream feeds. I think the baby's just trying to self-soothe, right? To soothe.
Yeah. Okay, so that's 3. 4 is a healthy baby that's full term. These really don't apply and aren't great for preterm infants or babies that aren't healthy or have delays. 5, you want the baby still to be on their back, always, not on their belly. 6 is no sweat, is what it's called, but really lightweight clothing for everyone. No swaddling of the baby. 7, safe surface. So no mattresses. Oh my gosh. No soft mattress.
You have to sleep on a board.
You can have your mattress.
It has to not be too soft. Okay.
No soft mattresses. No pillows, heavy covers. No gaps where the baby can fall down in, and no cords. So if you have your phone charging cord or anything, you want to keep that away from where you guys are at.
Right. Right. So what about swaddles? Why no swaddling? I thought swaddling was really good for babies, right?
Yeah. So there is really actually no evidence that swaddling reduces the risk of SIDS. They're a really good way to keep the baby warm without using a blanket, and a really good way for them to sleep longer because it kind of reduces their startle reflex, so they kind of are snuggled up and sleep better. But be aware, it's really easy way for babies to overheat, and has been shown to be a factor in SIDS-related deaths. Yeah. That's why
I always get hot at night too, so I totally
Me too.
get that.
Exactly. But I think in babies, we're always so conscious.
We want to keep them warm, right?
And so we overheat them a lot, and that's another reason that we don't recommend hats on babies. Not only for suffocation purposes, but for overheating. So like the first couple hours after birth in the hospital, yes, for sure. They're brand new. They have trouble regulating temperature at first. But after that, you don't really want to put a hat on them. It makes them overheat. So for putting layers on babies, a good rule of thumb is the infant should be in one more layer than you as the adult need to be comfortable in that room. So if you have on a pajama and one blanket, that's 2 layers, so baby can have 3. Which, in reading that rule, I was thinking about it, how many layers I need versus how many layers my husband needs.
Right.
What are we talking about here? I don't know. I think just try and use your best judgment. You know, if you find the baby sweating or like being more irritable, maybe it might be that they're too hot. So.
Great. Now, so I thought that babies, when they were swaddled, they would sleep better. But
yeah, and they do. I think they do, and that's why a lot of people swaddle them. But it doesn't decrease the risk of SIDS. But you can still use them until the baby starts to roll over. It really helps them sleep better, and that's great. But once they start rolling over, they really need their hands to kind of push up if they end up rolling over and getting their face out of the mattress. So once your baby rolls, no more swaddling the hands down. They still have those like sleep blankets. But you can use that where the hands are out, but no swaddles where the hands are tied down.
Got it. What about I've heard about the weighted sleep blankets. I tried a weighted blanket once, and it was really fantastic. What about weighted sleep sacks?
I know.
They have those.
Yeah, a lot of adults love weighted blankets, and in theory, you'd think it would be good for a baby. It would help them kind of feel like they were still snuggled and cuddled. But right now, the AAP does not recommend them. There really haven't been enough studies to say, oh, they're not good or they increase the risk of SIDS. But because we're nervous that they would, because they're weighted, they kind of hold you down. We right now not recommended. Sorry.
Okay.
Yeah.
Well, let me ask you another question, Rachel. What about infant monitors? Because a lot of people have monitors. I mean, like the one like the Owlet, that kind of monitor.
Yes, that's a great question, and they're really, really controversial right now. If you don't know what they are multiple different ones on the market. The Owlet is the one that most people know, but they're monitors that hook onto the baby. They hook onto one place or the other. Some hook onto the diaper, some wrap around the foot, like the Owlet wraps around the foot. But they monitor baby's heart rate, respiratory rate, and or their oxygen saturation, depending on which monitor you have. And some of them will even send the data to your phone and send you alerts to your phone if their vitals kind of go out of a certain range that they feel is acceptable one way or the other. So a lot of parents find that it gives them relief.
I mean, how can you even call yourself a parent if you haven't gone to check on your baby to make sure they're breathing while they're asleep?
All the time. I'm like staring. Can I see his chest moving? Put my little finger under his nose.
Yeah. Is he breathing?
Exactly. But there are a few issues with these devices. One is they're not medical grade. And I want everyone to hear that very clearly. They are not medical grade. This past year or so, the Owlet did get FDA approval. However, they're approved as a consumer wellness device. And how the FDA defines that is they are intended for maintaining or encouraging a healthy lifestyle and unrelated to the diagnosis, cure, mitigation, prevention, or treatment of a disease or condition. And I read that directly off of what they say.
Right.
So, so these devices, they're not. Go ahead.
Yeah, they don't have to meet the same requirements then as medical devices, right? Because when the FDA approves a medical device, that's very specific. Yeah,
exactly. And they're not really intended to prevent sleep-related deaths. They're clearly for what they say, maintaining and encouraging a healthy lifestyle. They're not medical grade. So there's a few issues with that, right?
Right.
And there's a couple
people use them, right? I understand why parents like them.
Yeah. And I don't think I really understood it, and I was a staunch no, you cannot use these devices, don't get them, until recently. when I had a baby. But I want to talk about the issues with them that I see really quickly.
Okay.
And then we can talk about ways you can like use it to help you. So
Okay.
one,
Okay.
a lot of parents, and you know, Matthew, my brother, and his wife, they have one, and this was the reason they gave for using theirs. They use them for peace of mind, and I get that completely. Like I said, we're all running to check and make sure babies are breathing in the middle of nap time. But I really want to warn against too much reassurance, and the AAP even says this on their website. Just because you have that on there, I don't want you to kind of become lax and stop checking on them. What if the device malfunctions? You have a parental instinct. You know, even if you are a first-time mom, a new mom, you really don't feel like you know what you're doing, or a new dad, you really do have a parental instinct, and I don't want you to lose that by having this outlet on.
Right.
On the other end of the spectrum, I have seen many times the parents running to the ER because their outlet, their vitals were abnormal. Yeah, they were alerting for a vital sign. And now, if you know anything about kids, their vitals change frequently as they grow up. So the machine might alert for something that the machine is saying is abnormal, but actually is normal for that baby's age.
Right. You know, that happens in the hospital too sometimes. I mean, machines can help, but we always say just look at the patient. So for parents, I guess it's look at the baby. Is the baby okay?
Exactly. Right? Yeah. The important thing is do not rely solely on the machine. Use your parental instincts and continue to check on your baby. Even if the outlet says, hey, the baby's doing fine, still go check on them if you feel like you would have if you didn't have the machine on there. And if the machine alerts for a vital sign that's abnormal, they say, oh, your baby's oxygen saturation is really low. You need to go check on them. Well, go check on them. Don't freak out. Just go look at them. If your baby has low oxygen saturation and they normally have normal oxygen saturation, they're going to look distressed. They're going to be working harder to breathe.
Right.
They're going to have signs that they are struggling to breathe. Another thing is, like, if a baby is crying or coughing, that can make their oxygen saturation drop. They can hold their breath and their oxygen saturation can drop just like an adult. So go look at your baby. See, are they coughing, or maybe they're crying, and that's why. Maybe their heart rate is really high because they're crying.
Right.
So go look at your baby. Right. Exactly. Right. Yeah.
Great.
And try to troubleshoot the machine before you just run to the ER. So those are my big things.
Yeah, ER visits are expensive. Mm-hmm. So Rachel, tell us, what are some things that we can do to be protective, to protect our babies against SIDS? Is there anything we can do to help protect?
Yeah, I mean, of course, obviously, don't do all those things, but there are things you can do to help your baby too. So one is using a pacifier. I know I did not realize this. Yeah, until very recently, but pacifier use during nap time and bedtime is protective against SIDS. And they've done lots of studies. Yeah, they've done lots of studies, and they don't really know why, but there is a protective effect, even if the pacifier falls out during sleep. So you don't have to rush in there and keep putting the pacifier back in their mouth all the time. Just if they use one, then it can be protective. The side note, they don't see the same protective effect with finger sucking. It's really just pacifier sucking. And if your baby doesn't take a pacifier, don't freak out. You know, you can try different types of pacifiers, but just because they don't take a pacifier doesn't mean they're going to have a SIDS issue. So don't freak out. Right. And another safe sleep thing for pacifiers, another side note, don't attach anything to your pacifier. That's another SIDS risk. So they have like the little stuffed animals or the little blankets that attach.
That's too bad, because those are so cute.
I know.
I saw one with a little
I know.
Those are so adorable.
I know.
Yeah.
And right now,
Good
you know
though.
how everyone, I don't know, in my generation, everyone's addicted to Target. They have like a one with the Target dog on it that my friend got. So there's a lot of really cute ones, and they are,
Yeah.
advertised really great, but there are SIDS risks. So try not to use those,
Okay.
especially when they're sleeping.
Hmm.
So pacifiers. Another thing is vaccines. A lot of parents have asked me this and have the question, if vaccines cause SIDS. And I see this a lot on social media too, people saying, oh, vaccines cause SIDS. And, I think the concern comes from the timing, right? So most infants get their vaccines at 2 months, and they get boosters at 4 months, and then again at 6 months. Yeah. So, and this is the time frame when we see the most cases of SIDS happening. So, I mean, as medical professionals and people, they did studies on this because they were also wondering. But their studies do not show a direct link between vaccines and SIDS. So even babies who are unvaccinated for one reason or the other have the same percentage of SIDS. No causal relationship, but actually they maybe might see a correlation with a positive effect, so a protective relationship between vaccines and SIDS. They're doing more studies, but the initial studies show that maybe the kids who are vaccinated have a lower risk of SIDS. So that's good to know.
Yeah.
And then, of course, breastfeeding. Studies show that feeding human milk reduces the risk of SIDS. So that's why the AAP definitely recommends breastfeeding exclusively for the first 6 months. Yeah.
Okay. Well, Rachel, this is really good information, because SIDS is so scary, and all parents want to protect their babies, right? That we want to do what we can to keep our babies safe, right?
Right. And it's just horrible with parents who have to lose their kids to this. You really don't want that to ever happen to you. No one wants that to happen to you. So these are the current safe sleep recommendations. But like I said, everything you can do in these recommendations, in these protective factors, are just going to lower your baby's risk of SIDS. I recently have seen firsthand how hard they are to follow at times when your baby just doesn't want to cooperate. So we're all parents just really trying to do our best. Try not to beat yourself up if you fall asleep with your baby one time or another. You're not a bad parent, I promise. And I'm telling this to you, but I'm also telling it to myself. Just do your best. Just really do your best. And, the American Academy of Pediatrics, they know the issues and the struggles that we have as parents with these safe sleep recommendations. And actually, they are starting to conduct more studies to determine how to best help parents in this area. I actually saw something pop up on my Instagram a couple days ago on the American Academy of Pediatrics Instagram, saying they're doing studies on how women and mom and dads are having trouble following the safe sleep recommendations for many reasons, and how trying to figure out how to best help. So
that's great. Well, I know that my friend who lost her baby to SIDS really went through a hard time blaming herself. And of course, it wasn't her fault, right? Sometimes, even when parents do everything correctly, sometimes bad things can still happen. Yeah.
And, I don't want anyone to feel like they're alone in falling asleep with their baby, holding their baby, or not being able to follow all of these recommendations to the letter. Like, even if no one is saying it out loud, we're all having trouble with this. I feel like as a pediatrician, no one ever came to me and said, I'm struggling with this. Everyone always tells me, oh, my baby sleeps in the bassinet soundly. And now I know that you guys are all lying. But yeah, sometimes bad things do happen, but thank goodness it is very, very rare, and something that most of us won't ever have to deal with.
Right.
And I pray you don't have to deal with that ever. But yeah, it is rare.
Right. And I agree. We pray that we never have to deal with that. Well, Rachel, thanks for this episode. It was really helpful. I learned a lot.
I did too.
Yeah. So I think that's all we have for today's episode. But if any of our listeners out there have questions that you would like for us to answer, or maybe you have ideas for a podcast you'd like us to do, please send us a message either in the show notes for the show or on Instagram or Facebook. It's Mama Doc, Baby Doc.
Yeah, we'd love to hear from you. Have a good day. Bye.